1 in 4 14 to 16-year-olds in East Sussex have tried a recreational drug. So, the research team have been working with us, our parents and professionals to find out how to reduce or even prevent recreational drug use in young people at secondary school through structured lessons and theatre.
Part of the work we've been doing through this Theatre and Education project is to work with schools through the PSHE hubs that we've been funding. So that involves peer-to-peer, school-to-school support around PSHE provision. And one of the ideas that we've been working on over the years is a theatre and education approach.
So PSHE is a statutory subject that all primary schools and secondary schools need to deliver right up to post-16. It looks at issues particularly relevant to young people around their personal well-being, their social well-being, and moving forwards into the future, including financial management. In relation to this specific project, we've been focusing on the health element of PSHE around drugs, alcohol and tobacco education.
The idea was that we would have an intervention based on a theatre play which East Sussex County Council has been delivering in its county for some years now, jointly with a theatre company called Solomon.
Hey Lucy!
Tom! How was your Christmas?
Fine, thanks. How was yours?
That was great, thanks.
And we then started talking about ways of going about, which meant offering this play to all schools in East Sussex, or secondary schools that is, then developing participant involvement, so that meant that pupils but also potentially teachers and parents could get involved in designing this study and then also in providing guidance on how to deliver it.
We recognised that a drop-in theatre production that is a one-off may not be the most effective way to deliver messages to young people. So we wanted to build a more comprehensive wraparound programme with curriculum support before and after the theatre and education performance. So the purpose of the performance is really to provide important and complex messages on the problems and issues that young people are facing in modern life.
Why would I want to do that? Barry's your boyfriend, not mine.
Why are you in such a grump?
Yeah, so our involvement in the project primarily was to convene a sort of a solid group of young people, or groups of young people from across East Sussex, and then really to help shape the content of how the Theatre and Education project would work.
It's very open. They've come with an approach that lets us all speak about how we're feeling freely, and talk about our own experiences, our own ideas.
Young people adding their voice and their experience to that then means the plays are more effective.
The main bit I enjoyed was the family dynamics, because at the beginning they showed us the relationship between him and his mother and the stepdad, and I think it just makes it more relatable to the viewers that would live in a situation like that.
Pick it up later. I don't feel well.
You're not listening.
Hey Mum, I was watching something.
Yeah? Well, I don't care. Jane?
So our findings found that teachers and pupils really enjoyed the performance and felt really engaged. Many told me that it was a welcomed change from their normal lessons, and it gave them a chance to really immerse themselves in a storyline with relatable characters. As one teacher put it, pupils enjoyed it so much that many of them probably didn't even realise that they were learning.
Yes, so the Youth Advisory Group met several times from the beginning of the academic year, and they watched the show. They watched the old previous version.
Yes, we did. We watched the old one, then we had a process of going through how we can change it, make it better from obviously a student's voice.
I collected data from young people, teachers, a little bit from parents and carers, and from one of the actors as well. I ran focus groups in schools, so I went into 6 schools. And it is amazing when a young person, if you're speaking directly to them and asking questions, it can feel quite intimidating. So just having stuff on the table to, the minute that they kind of pick up the colours and start drawing and doodling and writing, you know, the mood really relaxes in the room.
There's been a couple of models in the last 20 years that have really underpinned the work that we do, but the Lundy model is becoming the sort of benchmark standard for how you do good, positive youth participation work. So this idea of voice, space, influence, and I always forget the fourth one. Audience. And those key factors just really shape every element of the work, because any one of those segments is missing, and you can't really say you're doing effective young people's participation work or voice work.
A highlight of this project has been seeing the young people's reaction to the theatre and education.
I think it's changed why I think people take drugs. Like there's more reasons why people would.
Anyway, I need your help.
With?
Take these.
Lucy, what's this? These drugs, are you mad?
Oh.
I don't want them, I'll take them back.
I'm going home now. What if my mum finds them? Just cuff them for me.
I want to get in trouble for something that's not mine, Lucy.
You're my best friend and I trust you with them.
I know. I'm yours too. But this is a bit too much, Lucy. What if I get caught?
I promise you won't. You only idiots get caught.
Speaking to pupils, they said that the performance works best when storylines are authentic, the messaging is non-judgmental, and when they felt they could relate to the characters. This really helped them to spot red flags in their own relationships and really reflect on their own behaviour.
From the beginning, I could see that the cigarettes were quite outdated, and the music, and now in the new one they've replaced the cigarettes with vapes, and more alcohol has been used in it, and the music has been updated to what the kids these days listen to.
They wanted more upbeat. The music that was there before was very ploddy and not really right. So we definitely changed the music.
Staff really enjoyed the resources, so the lessons, and said that it really opened up conversations after the performance that wouldn't normally happen. However, there were many teachers that said that due to lack of timing or capacity, they weren't able to actually deliver this.
They were curious. They're curious about drugs. They're curious about drinking, and that's something that we included in the play, not just because of mental health and exam stress, but they're bored sometimes, so they're thinking, oh, I'll just try it. I'll try drinking, you know, underage drinking. I'll try doing drugs and stuff. So we try to include that in the play.
Our analysis also found that it was good value for money, mainly through potential benefits in reducing unemployment and youth violence in the future.
We asked young people whether they'd used drugs within the survey. Only a small percentage of young people said that they had, and that's what we'd expect at this age group. The purpose of the intervention is to try to reach young people before drug-taking behaviours have started, to try and influence those in the future, so that young people can think when they come across drug-taking opportunities to have a toolbox and the skills to respond to that appropriate in the way that feels right for them.
Through our East Sussex PSHE secondary hub, our teachers have been able to provide us with some really positive feedback around the project. They received a CPD session that helped support their non-specialist teachers. Also, having a lesson bank of quality assured learning experiences has really supported their delivery within the school. Anecdotally, a lot of them have said that they wouldn't be able to provide this experience had it not been funded through the local authority.
We've also developed resources available on the East Sussex County Council website that can help others design and deliver their own theatre in education project. So this is really important to get right. Everyone benefits from getting it right for young people. It's not just about prevention now, it's also about building a healthy, stronger society for the future.